Um, you could have both. I mean, people reserve the right. People reserve the right to have more than one problem.
Oh my god. I'm glad I'm not a doctor and you are, Dr. Kevin. What I need to ask you, like, what made you pursue this career? Because just talking about it, I'm like sweating, you know, like imagine all of those issues every day after day. How can you handle this, Dr. Kevin?
So when I first went into practice, first of all, by trade, my base degree is I'm a doctor of chiropractic.
Oh,
And when I went to chiropractic school, I graduated from there in 2001. And I went into practice and I was helping people with back pain, neck pain, knee pain, headaches and migraines, things like that. And I was pretty good at it. And word was getting around and my practice was growing. But every once in a while, somebody would come in the office with some kind of a weird medical issue that I couldn't help with traditional chiropractic methods. And as a result, I started to get really curious. I wonder what could I do to help these guys? And eventually that led me to attend a couple of seminars on clinical nutrition. And then I went to more seminars and read more books and attended more seminars. And eventually I became a diplomate of the American Board of Clinical Nutritionists. And those are people that look at lab tests and diagnose if what's going on and then prescribe certain nutrition, whether it's your diet or it's certain supplements to try to complement the diet. And then eventually this whole thing blossomed into pure functional medicine, which is really a patient-centered, personalized approach to healthcare. So there's two types of healthcare. The one type is called allopathic healthcare. Allopathic healthcare is what's done by medical doctors. And the purpose of allopathic healthcare is to chase a symptom with a drug, with a chemical. So if you have certain symptoms, then you're put into this diagnostic box over here. And then if you're in this diagnostic box, these are the drugs that you get. So that's the standard of care. The functional medicine doctor does not chase after symptoms. Functional medicine is about it's a personalized, patient-centered approach to healthcare. So we treat the person, we don't treat the symptom. So the functional medicine practitioner asks the question why. For example, why would you have thyroid problems? Why do you have high blood pressure? Why do you have glaucoma? Why do you have indigestion? So we ask that question why. So that's taking it a step further and asking that question, what could we do for this person to alleviate this symptom, not to just temporarily mask it with a drug? That's really what drugs do, is they mask symptoms. But we want to find out what is causing that problem in the first place so we can give you a permanent resolution to it.
I see. So you just described, just so I understand, you described the difference between allopathic healthcare versus functional medicine, and how allopathic healthcare basically just masks the symptoms with a drug, and functional medicine actually treats the person by asking the why. Did I get this correct?
Yeah, that's pretty much it.
All
So
right.
the functional medicine requires us to do a little bit of detective work. It requires us to investigate the problem at a much deeper level so that we can give them a permanent correction, not just a temporary patch of the symptoms. I can really only think of one drug in the entire world that can actually cure a disease, and that is if you use antibiotics to clear out a bacterial infection. Other than that, I can't think of any drug that's actually going to cure a problem. It may manage the symptom temporarily, but as soon as you stop taking that drug, it's going to come back. So, for example, they have medications to help people with high blood pressure, right? There's all kinds of drugs out there for high blood pressure. And if you stop taking it, guess what's going to happen?
The blood
It's going to
pressure will
come
go, yeah, come back.
exactly, it goes back up, right? So that's not, they're not really giving you a cure, are they? They're giving you a temporary patch.
Oh man, maybe I'm naive, but every time I went to the doctor, I had this fantasy, at least in my head, that they were there to treat me, you know. But if you stop to think a little bit, that's not financially. There's no returns on that. They need to keep making money, right? They need to keep selling you the drug to keep sedating you. That's what they're there for, and I don't like to think about it. It sounds they're against me.
Well, the medical doctors, I don't think it's because they're bad or evil. It's just it's a difference in philosophy. They're there to try to remedy a problem by giving you a, a medication. That's what medical doctors do. They work with medications. And when you add in the insurance industry and you add in the regulatory industries and all these other people, it can become a very, very complex issue very quickly. Regardless of that, the better solution for chronic issues is a different approach. Now, I'm not sure how it is in Germany, but in the United States, medical doctors are really, really good at treating acute problems or new problems or problems that require a heroic measure to save a life. For example, like a heart attack or a stroke or a gunshot wound or a broken bone, they're phenomenal. They are the best in the world at doing that. But however, when it comes to managing chronic problems, they don't have a very good track record. And it's not my opinion. That's in the medical literature. The In the United States, we spend $4.3 trillion a year on our healthcare. That is such an enormous amount of money. It's more than the next 20 countries combined.
Mm,
And of the $4.3 trillion that is spent on healthcare, 90 cents of every dollar that is spent is done treating chronic problems. And the medical doctors don't have a good track record at treating chronic issues. Those are things like high blood pressure or thyroid disease, autoimmune disease, um, uh, infertility, things like that. Those are not acute problems, or they've been with them for a long, long time, and the drugs are not sufficient to correct the problems.
maybe that is because those problems are only fixable or curable through your own actions. Maybe I'm just assuming here, like those are things that you need to, like you need to go to the gym, you need to eat healthy, and that's not something that any doctor can fix it for you. That
That's correct. So in the United States, people will um, work 40 to 60 hours a week, and then they will come home and take little Billy to baseball practice, and they got to feed them. So they go to McDonald's drive through. And after a while, they start to gain weight. They start to develop high blood pressure. They start to develop anxiety, and so it goes on and on and on. And there's, I think that the average person is taking multiple pills all the time just to manage their chronic issues. It's a sad state of affairs, and I'm trying to help people one person at a time.
hopefully the podcast expands your help.
Yeah, exactly.
Dr. Kevin, I need to ask you. So like that's a very interesting theme that you're talking about, the subject that you're talking about right now, because as I mentioned before, I think before I don't know at the beginning of the conversation that I love the U.S. I've been there a couple of times. Last time I went there, I ate so much. It was so good. I mean, but I would never